UPTH, there were 13 malpractices where they were to be doing to patients, not giving the appropriate amount of oxygen when people pay for it. Several reports, several weaknesses were also contained in that report. And the UPTH responded and said that first it was the Midwives and Nurses Association who made the reaction saying, oh, those are staff. We don't know the nurse. We don't know the people you're talking about. And then there's the official report from the UPTH saying that the Guardian should retract. The Guardian should. So I don't know here. You might do one thing for instigating. I'm talking about and who is in the view of God. Good have you and it's your good afternoon. Please say again on
I think last morning in my facility. It's been ongoing for some time ago. I read on that, but this time around it's too deep and do more investigations to get to and not seen. Particularly, I had a relative whose son was admitted there for like a week. I visited for a time and so analytic instinct, and I decided to move in and do a deeper work. And we all know that investigative reports uncover something. It's reasonably concerned, and it has to be issue based, and it must have evidential or what we call empirical evidences to justify your finding. Investigative report is not just what someone would delve in and do it in a hurry. I must say that the report I did and published in June 1st took me 3 months. So I was patient, I was consistent, I was always in the hospital taking my evidences, taking my pericles, because when you carry out investigative report, it's obvious that the reaction such as UPTH will certainly come up. So that's what we investigative report that is and loaded or evidential proof. So in my report, I did also take so what are the next at the ICU ward in UPTH. Also provide what we call journalism. Solution journalism is the report that highlights what others have done with similar challenges and brought solution. So that's what I'm just to give an instance of one of what I updated in my report, because time may not permit us to go really in detail. So in the course of my visit to UPTH, I observed quite a number of things from different wards. I decided to concentrate in ICU. That is why I investigated each so that I can look in particular units. So there were companies of oxygen loss and all that, but I did to see myself and observe things myself. I was consistently going to that particular unit. I met friends with some of the patients and all that, and we proceeded. A particular day came, and the patient happened. He had oxygen and notified him that need for extra oxygen. Luckily, I was there with him, and we moved on to the oxygen units. And when we got there, the oxygen guys, the people that are in of oxygen, they opened the register, and he noticed that he had some extra 3 to 4 oxygen left.
Yeah. Okay.
Yes, outstanding oxygen. And the nurses that they asked him to go get the oxygen, we got back there and they were startled. They didn't know what to say. And the guy left, and in the middle of it, they also and placed for another oxygen. So I said, I'm really not going to go into detail. So these are some of my observations that propelled me to, delve into that in-depth revealing report. I'm quite glad that it's not just like the team at NUJ yesterday. The report is not targeted to undermine the effort of the facility or targeted at anyone. It is intended to ensure that government stands up to do what is needful. And I am quite glad to hear from the management that the management has acknowledged that the report is bringing positive impacts.
Okay.
It's also bringing hello?
Yeah, I'm listening to you. Okay, so I would like us to now focus on the acknowledgement. So, what made the UPTH acknowledge the report? Because at first we were told that you had to it was during our meeting. The UPTH management requested to visit the NUJ council, and also requested to see me, and we were all there. And joyfully at meeting, as we came, the head of the team that led the team
I may not mention the name here.
Okay.
He noted that yes, that the media reports are also important and also has a positive impact. And he also told us that during COVID-19 pandemic, the federal government started what they call the oxygen plant or oxygen facility, where in my report I noted that lacuna, that gap, because in UPTH, instead of using pipes to deliver oxygen to the patients, what we see is you see someone that uses what we call truck or mini wheelbarrow to push the gas cylinder up to the patients wherever their beds are located. But after that report, it is quite an interesting impact that the federal government moved in and completed the oxygen facility that was abandoned since 2020. That is immediately after the COVID-19 pandemic. And as we speak today, the Apex Holinist has I think about 4 manifolds of oxygen plants, and with that will now enable patients to take oxygen directly from the plant. It will be piped to their bed, and that entails that you will pay exactly according to what you consume. And whether you agree with me, this move, it will corruption. And that is one. There's another record by my report that we owe the Grammy Award winning mission, Boy, two when facility the UPTH management, he gave money to indigent patients, them their bills. I think that has also brought relief to the sick persons and to the public. I must say at this point that is what journalism is all about. Okay. When we do our work, we are deliberate to bring succor to the helpless.
Okay, now I've got a question. All of these positive implications of that report, was anything said about the people who, were perpetrating the malpractices? And I'm asking this because during the reaction, during the reaction, we saw UPTH say, that some of these statements made mistake. Can you help with that one?
Okay, yeah. During the meeting, I was able to provide my evidential proofs. I have my records, my video, and other materials which I may not reveal at this on-air interview, because these are some of our secrets. I have all my backup. I have all the proofs and empirical facts to justify my report. It was at that point I played about two recorded voices and all that. So they also made the NUJ to understand that they moved in and investigated the situation, and some staff that we linked to the issue, I think they have administered some punishment to them. So I think it is left for UPTH to.
The question I want to know, I'm trying to understand, were they nurses, were they doctors, were they technicians, did they specify the units of these
No,
staff?
there was no specification. There was no specification, but it was noted, it was confirmed, staff having sanction regards to that, and that the UPTH is now very determined and intentional to ensure that the right thing is done in the hospital, and that the hospital adheres, to the standard.
All right. Now, Anne Godwin, I really want to thank you for that investigative report. I really want to. But then, have you followed up with some of these things as talked about by
Yes. Particularly, I've been after the report. That's why I tell people who want to come into this noble profession, you must be courageous, you must be fearless. So long as you know the ethical standards, so long as you know your onion, you must be courageous. Do not be deterred. It is quite obvious that when you carry out investigative report as such, certainly, the organization or the management will certainly react. It is expected. So I was not deterred when I saw their recent, their reactions or them in story, because I have my empirical facts, I have my evidential proofs. I was not shaking, and I was on management. I must tell you that my management has been following up the issue. So I was not discouraged. Not then I abroad is saying we don't live. So I've been visiting hospital since after then. If I was there today, this early morning, I also saw the if you check your WhatsApp, I'll the pictures, some of videos, and of the manifold oxide is ongoing. I see there is sanitation going on in UPTH, but there are other areas they still need to look into, and that is the essence of marriage. The government, public, spirit individual should not, just leave UPTH. There is need for all hands to be on deck to ensure that with that apex tertiary hospital gets the best, best gets to its best standard. So I observed some things. I noticed that there is still need for some individuals to come in and support the management.
And we would get back to some of your observations, but we do have a commercial break, so please stay on the line.
Okay.
We'll come back to some of your other observations. All right then.
And now, hard facts on 92.3 Nigeria Info.
All right, thank you for staying tuned to 92.3 Nigeria Info. It is the bottom of the hour, yes, 4:30 p.m. and I am Kalada Gurubatu, and I'm speaking with Anne Godwin, who is the chief bureau of chief bureau, of the Guardian South, and we have been talking about UPTH saga. You know, there was the Guardian Report some time ago, about a month ago, and in that report, we got to see, the malfeasances that happen at the UPTH, and now we're hearing that the reporters have been able to have some positive implications, some positive effect, and certain things are ongoing at the UPTH, certain changes that is, and it is a good one. For instance, according to Anne Godwin, there is now a pipe that leads to a manifold oxygen room or center or something, and so it flows straight into the hospital, and you get to pay for it, and when you pay for it, whatever you pay for is given to you. So it removes extortion, it removes all the illegalities, it removes everything, anything illegal and negative. So welcome back, Anne Godwin. It's good to have you on the show.
Thank you, Kalada.
All right. So just before the break, just before the commercial, you were trying to tell us some of the things that you observed, during your visit this morning to the UPTH, the University of Port Harcourt.
Okay. I noticed that the workers are now more cautious of their activities, of what they do. Unlike before, that you just do whatever you like. I noticed there is also a slight monitoring, but I think there is need for a strict monitoring of the activities of the workers. But most importantly, I feel that there is also need for government and individuals to come in and also help out. I noticed the environment is still not quite tidy in terms of the gratis and all that. Public spirited individuals can come up and see that as a kind of social responsibility. Companies can do that, see it if they can tidy up, clear the grasses every month or weekly. That would be nice, because hospital environment is expected to be clean, is expected to be attractive and all that. So at the moment, I must tell you that UPTH management, from my latest observation, I'm not here to exonerate them, but I speak based on facts, based on what I see. That there is this, determination. There is this fact that they are now up and doing, and they are strict and rigid about it, and the workers have become more cautious of their activities.
All right. So I'm going to open the phone lines now so that listeners can join the conversation. If you are listening, this is the time for me to get your views on the issue under review. What are your thoughts, basically? What are you thinking? Last time we asked a question relating to this UPTH saga. I remember asking, what was your experience like, when you visited the UPTH last? Now, I'm going to switch that. I'm going to move away from that. I'm going to ask you what your thoughts are, because my guest has said that there is certain improvement. It's not yet 100% victory for Nigerians who patronize the UPTH. However, there is progress. There is a positive change. Certain things have been done to reduce extortion. Certain things have been done to reduce some of the malfeasances. Are you happy about that? That's why I want to get what your thoughts is as it relates to this very issue. So 0817-923-0002 and 0817-923-0003. 0817-923-0007. Those are the call numbers. I take them again. 0817-923-0002, 0817-923-0003, and 0817-923-00007. WhatsApp number 0809 0306 I tell you something, hospitals like UPTH and the River State University Teaching Hospital are very important hospitals in the sense that there's certain things that they would venture into medical wise that certain private hospitals may not. So I think they're called specialist hospitals, something like that. So you want to think about how important these hospitals are to the people living in River State. And so when we talk about these things, it's because we want the best. We want the best medical supply or service that we can get here in River State. I've got Court. Court is calling me from Chuba. Court, welcome. What is on your mind? I'd like to hear from you.
Yeah, good evening, Canada.
Yeah, welcome.
I just want to congratulate the guest for her encouragement. She will go around the hospital, monitoring what is happening. Now the hospital has picked up. I just want to say she should keep it up.
All right.
If all of us begin to do like this in our small spaces, at least this Nigeria could have been a better place. For the grass, they can employ labor. I saw in Uniport here, in the morning you see some people cutting grass, some women sweeping. That one is not difficult for government to do. People are looking for jobs to employ. They should flexible. Madam, keep it up.
All right, thank you very much, Court from Chuba. Thank you very much. I've got Dixon from Imboba. Dixon,
Hello.
welcome. Yeah, welcome.
Thank you. I contribution to the issue on ground.
Okay.
The day before yesterday, I went to UPTH, and I must tell you, first, my observation, probably the lady who just made that recommendation or maybe observation too. My own is that entrance to the UPTH, a pregnant woman that is on an emergency situation, they can't take her to UPTH from that road, and you know it.
What do you mean by that?
Entrance to UPTH. The road is terrible.
Okay. You mean towards where the fast food joints are, right?
Yes, from
Okay.
Alakaya down to UPTH itself. It's bad.
Okay.
Secondly, they are generating sets. Probably after 10 a.m. in the morning, it doesn't work. 6 p.m., they on it back. To the next day.
Are you saying the entire facility? Can it be from when you say power supply is being turned off by 8, is it the entire facility?
I can barely hear you. All I'm saying is that the electricity supply to the hospital is epileptic.
Okay. All right. Thank you, Dixon. I don't know. And there is a squeaky sound coming from your end. I don't know where that is coming from. But can you hear me now?
Yes.
All right. So the last caller just talked about power supply. What did you observe when you went there? Because it's saying there's a very poor or paltry power supply at UPTH.
Okay. Unlike when I was carrying out my findings, investigative reports, I could go there and stay for long hours. But as at the time I visited there was power supply, so I didn't stay more than 3-4 hours, unlike before. So I could not really, confirm that for now. But as at during the visit, the management told the energy that relative improve in power supply. He also acknowledged the fact that Nigeria is also having challenges in the power sector, and we are aware of the fuel issue. So, but I'm not absorbing them. So, as at the time I visited there was power. Then the issue of road, I think that is also important. Is pertinent for people to look into that direction. The road from Elekaya Junction to UPTH is not quite smooth. I noticed some potholes. I noticed some, rough edges. So there is need, considering that the facility is a health institution, that sometimes there could be some critical situations that may need a very smooth ride. If a woman is pregnant or under labor, she shouldn't, be driven through such kind of rough road. So these are some of the areas that are begging for attention. It is also important that as the report have started bringing goodwill to the hospital, some persons should also look into that direction. I remember the past administration, that should be former Governor Nyesom Wike. He made a promise of fixing the road. Kalada, you can recall, or is it the University of Port Harcourt road that he promised fixing? I think the road. It should be UPTH. Yes.
I think it should be UPTH, but then we'd have to go back to our archives.
Yes, it's UPTH. Yes, okay. But it's like the road has got back again. They didn't do a very solid work on that road.
All right,
so there is need. So I'm also glad that the report is betting hopes in betting hope medical excellence. I see, that vigor of the UPTH management to rise to the peak of excellence. So that is the essence of our report. Yes, we are aware that before now, let me take you back to United Arab Emirates. Before now, they were traveling outside the country to get medical attention, but as we speak today, because of some of the media reports and the determination of government over there, today the United Arab Emirates is enjoying the dividends from medical tourism. People visit the country to enjoy medical tourism. I also may interest you to know that they are also exporting it. A well investor in Rivers State told us recently that the UAI is also making efforts to bring in some of their hospitals here, or to set up their hospitals here. So this is a good development, and these are some of the things that our reports are targeted to achieve.
All right, let's go back now to the phone lines. Let's take this one. 92.3 Nigerian Info. What's your name? Where are you calling in from?
Hello there, good evening. My name is Chris and I'm calling in from Ozoba.
All right, Chris from Ozoba, welcome.
With respect to the road, it's quite unfortunate. Just the way Nigeria will go bad and somebody may want to point a straight finger to Tinubu and not wanting to look at the ministers around him and how well they are doing. It's the same thing. A contractor did that road from the day one. If you go close, you will notice that asphalt was placed directly on laterite, which red mud. And that is not standard of building the road, especially in a water-logged environment like Rivers State. So it's very absurd that at the end of the day, no matter the level of works that have been done there, it is still looking the way it is, because the foundation is very, very poor. So that environment, that section needs to be removed and done properly, with sharp sand, stone base, and the proper work done on that section, and that place would stay. But unfortunately, when the place as it is right now is looking bad, there is a finger pointing to the management and forgetting who started that work originally.
Okay.
So right now, I'm blaming the contractor that was given that job that didn't do a standard job that should last for a period of time. And that's very bad. And that goes to so many other things that can make things not to work very well in that place, including the human factor. So it's good that whoever that has something to do with respect to that institution or facility does what they are supposed to do and do it right. Thank you very much.
All right, thank you very much, Chris. Thank you for your time. And now I want to actually go investigation. Did you have time to chat with nurses or medical workers at the facility as to what their welfare is like? Because some can make the argument that welfare may be the reason why they act the way they do.
Okay, that is pertinent. Yes, I had discussions or interviews with not less than 10 workers in that facility. And first, most of them expressed reservations on what is going on, or some of the things I captured in my report. Sincerely, most of them are not happy with what, my detailed reports that pointed at some of the illegalities and all that. They were not happy at all. They have been craving, how to speak up, but they didn't know. So some of them were quite excited that I came in and they spoke to me, but you should understand, they spoke on the condition of anonymity. On the issue of their welfare, that is quite glaring. Their welfare is quite poor. And when I look at their allocations, the budgeting for the health sector is quite poor. Some of them, I must confess, we are not just there to criticize. Some of them are also hardworking. Some of them are, very, very focused on what they are doing. Some of them are doing quite well. Not all. So I think there is need at this point for the government to look into the issue of their welfare, the welfare of health workers generally in Nigeria and Rivers State. There is need to upscale their welfare packages. The NLC has been clamoring for increase in their packages, and you are aware about what is happening in our Senate, where the Senate president has even given, allegedly given a nod to the approval of.
If you're going to talk about the presidential jet, I don't think it's allegedly. He said if it is presented on his table, he will approve it. Yeah.
The irony there is that request has not been presented in the House, and he has already given an approval ahead of time. So you can imagine the system we are in. You can imagine the country we have found ourselves. We are workers. Some of these workers, they sleep in the hospital. They stay there from morning to night. Canada is quite heartbreaking, honestly, that Nigeria leaders should begin to look into the direction of these Nigeria workers. It is necessary. I have been privileged to visit other parts of the, outside the country, and I see an organized system where things work. You see the health workers, they deliver with, joy. They carry out their works with excitement because they look well, because they know what they benefit, and they do it with all, adhering to the standard. You see security agencies doing their best. Hello, can you hear me?
I'm listening to you, Anne.
Sorry, a call is coming into my phone. Okay, yeah, you see the security agencies so organized, and such organized environments, expectedly you will see investors trooping in. You see a system that is moving on well. But it is quite sad that we come into a country where, as at the last time I checked, Nigeria is one of the top richest country in Africa, but it is the poorest. This is quite disheartening. And it will also amaze you to know that about 1.26 trillion is lost in corruption and tax evasion and all that. This money, if it's put together or if it's properly utilized, it will be able to lift about 1.4 billion people out of poverty lane. Right. So this is what we are talking about. Our Nigerian leaders are just they are selfish about their own welfare. Right. So it is necessary for them to begin to look to the direction of health workers, not just health workers in Nigeria, but other workers in our country.
Right.
Thank you.
Let's listen to Emmanuel, who is calling in from Port Harcourt. Emmanuel, welcome. What is on your mind? I'd like to hear from you. Emmanuel, can you hear me?
Hello?
Yeah, welcome.
I'm hearing you. Hello?
Yeah, go ahead and let's get to hear your thoughts then. Can you hear me, Emmanuel? All right, I think we do have a network issue there. But this one says on WhatsApp, tell the management to cut grasses in their environment is a good one. Could be election with some of the lecturers not grooming. It's 192.9.
I am Mr. Korea.
All right, Korea, welcome.
Thank you, my brother. You see, I am from River State. And my brother, what I am hearing from my brothers, my sisters, I start to wonder that at what point can we get a leader? Now, the truth is that 2015, the same our ex-governor acted when
are you sure you're calling? I don't think you're calling the right place. But let's take this one. It says, nothing. I mean, nothing has changed. My son was discharged yesterday, and not God, my son was gone. They took my son to a surgery room last Thursday, kept him in a room from 10 a.m. to around 4 p.m., brought him back. On the note that working, they actually brought him. He collapsed around 4:47 p.m. My wife and other family members were crying. The doctors rushed to him and revived him. Later took him to the surgery room around 6 p.m. There he was operated, and that is how I got back my son. The doctors will bargain with patients from outside, leaving those admitted on bed till point of danger before attended to. I am Jimmy Bekbe. Is it Bekbe? I think that's the name I'm saying there. What's your reaction to that, Anne? And in your report, you did actually cover the fact that some doctors have hospitals outside, private facilities, right? And Jimmy Bekbe is saying that he experienced that. Was it yesterday? Did he say yesterday? I think he said yesterday he got discharged. His son got discharged. So he's giving a recent narrative or observation as to what is happening in the UPTH. Can you confirm if the positive changes?
I told you that my findings took me like 3 months. So for me to confirm this, it will really take some time. It's not something I just told you of the ones that are easily to be confirmed, the one I can see, while walking around. But for you to confirm such a claim, what the person have experienced, you just have to be patient and go through some processes to witness that. In my report, I captured it as at the time I make the findings. It was quite clear. It was not what at the time I carried out my report was obvious. After my report, they call it either monitoring committee, a kind of a committee that is not quite visible, so to monitor the activities of the health workers there. Right. I think that will be quite commendable. That is one of the best way to cope that issue. You need a committee, people that will be going around, monitor the activities of the health workers. Even the HODs themselves, the HODs of different wards also need to be monitored. As at the time of my findings, I noticed that some of the HOD were not turning up to work as they were supposed to. And these are some of the things I pointed at in my report. Right. Some of them that have their facilities elsewhere. Right. So there is need for adequate monitoring of you can call it monitoring team, to investigate.
My time is up, so I would have to say my goodbye at this point. But thank you very much, nonetheless.
You wouldn't give me time. I'd like to express my thanks to my management.